third, fourth session at this point of the AM virtual event. Thank you so much for joining us. I'm Georgia, I'm Deputy Editor of Aesthetic Medicine, and I'm joined by the lovely Dr. Sophie Schotter. Sophie is the Medical Director of Illuminate Skin Clinic in Kent, and she is speaking to us today on behalf of Venus Concept. So Sophie is going to be talking to you all about treating scars and wrinkles on all skin types with a novel nanofractional radiofrequency device. So in a minute, I'm going to turn my camera off and let Sophie just talk to you all directly. What we'll do is, if you've got any questions for Sophie, if you can just pop them in the Q&A box along the right-hand side of your screens, then we have someone here moderating, and I will come back on at the end and I will just ask Sophie your questions. So I'm going to turn myself off. Sophie, if you're good to go.
Sure.
Okay.
So I'm going to start oh, there we go. Perfect. So, yeah, thank you for the lovely introduction, Georgia. My name's Sophie Schotter, and I've been full-time in aesthetics now for about 6 years, and a few years before that part-time as well. And I'm speaking to you today about particularly the Venus Viva device, which is my favourite, my preferred radio frequency technology. So let me talk you through, bear with me, let me just work out how to change the slides. Sorry, there we go, perfect. So what can we treat with this device? We can treat various types of scarring, we can treat stretch marks, we can treat rosacea, we can improve skin texture and pigmentation, enlarged pores, deep wrinkles and rhytids, and also skin laxity. So quite a mixture there, but what stands out for me is that some very difficult indications which often we struggle to find good treatment options for, this device can really work very well. So it's an entirely, you can create an utterly bespoke treatment with the Venus Viva, because you can customize the ablation and the coagulation settings. You can customize the treatment for any different conditions. So for example, a treatment, if someone has more veins in their face, you may want to use more coagulation. If someone has very deep scarring, you might want to use more ablation. And this allows you to really adjust to the skin type and skin conditions you have in front of you. I'm going to talk you through our smart scan. Sorry, that's the clinic phone. I'm going to talk you through the smart scan technology a little bit later on in the presentation. One thing again that for me stands out is that the Venus Viva is safe for all skin types. It has a pretty low rate of post-inflammatory hyperpigmentation compared with other fractional laser devices, which obviously is important if we're treating skins of different colours and skins that are prone to pigmentation. The downtime of this is really very, very minimal. It feels a little bit dry for maybe about a week or so, but actually the visible downtime is very, very minimal. And patients love it. The satisfaction for comfort, for recovery and for results is very, very good. So when we look at the anatomy of the skin, we look at the epidermis and we look at the dermis, and we move through to subcutaneous tissue and fat. And with the Venus Viva, we'll talk about conductivity a little bit later. We're working predominantly on the epidermis and the dermis. This slide really nicely shows what happens to the structure of our skin between our 30s and our 50s. So our collagen levels are at their highest around the age of, well, before the age of 25. And from 25 years old onwards, we're losing 1 to 1.5% a year. Many of us maintain the integrity of our skin up until our 30s. And you can see that in the diagram on the left, the collagen strands are very orderly, they're intact. and you have lots of hyaluronic acid in amongst the protein strands. When we get to our 40s, you start to see more collagen breakage. You get to see that the strands of collagen are being destroyed, and that can happen through many different factors, both internal and environmental. And then by our 50s, we have significantly more damage to our skin. As women, this may be the sort of age where menopause accelerates skin aging, but we lose moisture and we lose structural integrity of the skin. There are 3 different types of collagen which are important here. So type 1 collagen is found in our skin, bone, teeth. Type 2 collagen isn't one that we see in the skin, and type 3 is what we often see in the early stages of scar formation. So what we're interested in long term is type 1 collagen. So some different types of scars we can develop. On the left are some different types of acne scars. So the ice pick scars are the ones we often see where it almost looks like people have multiple dilated pores. They can be quite small in diameter but look quite deep. The rolling scars lead to significant textural changes. And box scars as well can lead to a sort of an undulating appearance to the surface of the skin. And the hypertrophic scars are overstimulation of tissue as a wound heals. And we can get those types of scars, many of them on the body as well. So atrophic scars tend to be where things are dented. Hypertrophic is overstimulation, and then keloid is where that goes beyond the original edges of the injury, so when it overgrows. And contracture is when a scar shrinks in so much that we get contraction of the tissue, and obviously the dreaded stretch marks that aesthetically have been notoriously very tricky to treat. And these are some examples of what the Venus Viva can do with scar treatment. So if you look at this first one, obviously in a very visible part of the face, and it looks like a nasty scar that has been stapled. And after 3 treatments, we have a really beautiful result. And this is obviously the scar on the left is at still a relatively early stage of healing. And by intervening early, you're really getting optimum results. Good collagen stimulation going on. And these are some examples of the different types of acne scars we often see, as I was talking about a moment ago. And here are some results. And a very tricky patient to see acne scarring as deep as is on the left and in a Fitzpatrick 5 to 6. It means a lot of the treatment options we might consider are even riskier than they would be in a Caucasian skin type. Yet this result after only 3 treatments is very impressive. And I've personally used this on skins of all colours with confidence. And another beautiful example, I mean, this scarring is really very severe on the before and afterwards. I think that for many patients would be confidence changing, if not life changing. And another example after 4 treatments. I personally, in my clinic, do tend to recommend courses of 4, which are done a month apart with appropriate home care in between. Some people might need more, but that's where we start. So this is a brilliant picture of what happens with stretch marks. So you can see on the left, the structure of the collagen and elastin within a stretch mark, which is noticeably significantly denser in the squares on the right. So you can see there's increased both thickness and number of collagen bundles, and that the elastin content in the skin has increased. And this is after 3 sessions of treatment. And this is a result of one of our studies showing a statistically significant reduction in the area, width and length of the stretch marks from baseline. And for me, that's always been something until I've had my Venus Viva now for over 2 years, and until now until I had my Viva, I was really very reticent to recommend stretch mark treatments because I didn't feel I could achieve results for my patients. Now it's a different ballgame, and together with the right home care, we're finding some very satisfied patients. And these are some of the clinical examples. So to say that you're going to get rid of something is never realistic, but you can see how going from this before photo, which isn't uncommon in a woman after pregnancy, to the improvement in the after photo is very dramatic indeed. And this is on the backs of the knees. This might be the difference between someone having the confidence to wear a knee-length skirt versus trousers. And on a bottom. And this is after only one treatment. And what we saw on that slide, I'm just going to skip backwards, is that even after the first visit, patients are starting to see an improvement. So, how has resurfacing evolved over time? So historically, when resurfacing began to be used, it was ablative. We used to take off the entire epidermis, and people had a lot of downtime and a large amount of risk. People then looked at fractional ablative resurfacing, which allows columns of tissue in between to heal, followed by non-ablative, and finally we've ended up with using ablative fractional resurfacing. And the reason why we're so keen on this is that it allows us to achieve a high safety profile with a high level of efficacy and results. So we're sitting up here where safety, in the top right, where safety and results are excellent. Whereas when we look at the more old-fashioned resurfacing techniques, you either were sacrificing safety or results. So how does it work? So radiofrequency is essentially conducting electricity through the skin, and the conductivity changes in the different layers. It's at its best, we conduct the best within the dermis, and the epidermis and the fat layer are less so. So with our pins, we see both ablation and coagulation. So that means that you can get some nice results for rosacea and for thread veins with this as well. There's no need for a return plate because the pins act as such. So there are 160 pins on each tip, and at any one moment 4 will be active and the other 156 are acting as the return plates and receiving the energy back. And by doing this, we create columns of injury to the tissue with large areas in between of healthy, viable tissue, which will promote good healing. And we create these, this is a histological slide that shows the sort of column of injury. We create these micro wounds. And by doing that, we're activating the skin's natural healing responses. And this is a really nice slide also for people to look at long term. It's showing the impact of fractional ablation on the different layers of the skin. So if we look at the epidermis, first of all, we can see that the ablation will cause some holes, and that dryness I described earlier is actually tiny, tiny little scabs. We'll show you some photos of that shortly as well. We also get stimulation of the keratinocytes, which leads to reepithelialization, and you end up, your skin just looks, the epidermis just looks smoother and brighter. And within the dermis, we get some collagen denaturation from the heat, but we get the fibroblast stimulation. So we're getting synthesis of type 3, which with time will become reorganized, and we end up with beautiful, firmer, more elastic, healthier, youthful skin. The phases that we go through in healing are inflammatory. So as with any sort of injury, if we cut our finger, the area will become red, warm and swollen. We get aggregation of platelets and clotting factors so that we get initial sealing of the wound. Then we get accumulation of fibroblasts through clever cell signaling mechanisms, which will start the healing process and collagen production. Neutrophils and lymphocytes are automatically sent to the area to help fight any infection through the skin barrier breach. And the Langerhans and macrophages are there to ingest anything that's left over from unwanted cellular debris from the injury. We then go through a phase of proliferation. This is the area where the wound's quite fragile. So if you were to put it under too much strain, it would be more likely to reopen. We may get reepithelialization, and areas that are dense in appendages within the basal layer will heal much more quickly. So the face heals pretty quickly. And then finally, we go into a remodeling phase. So this takes longer. It can take up to 1 to 2 years, and is where the type 3 collagen is replaced with type 1 collagen. And this is where scars will go from being red to being softer, smoother and white. So when you look at these, this is an example of 2 types of wounds. Both have exactly the same surface area. But the top wound, the long, narrow cut in the skin, will heal far quicker than the bottom wound with the big circumferential distance. And that's because we've got far more tissue exposed to the deficit along the length of the wound. So your cells that are migrating to help the tissue to heal have far better access to where the site of injury is. And these are the shapes that we're creating with each pin of the venous tip. So the pins are extremely sharp and will penetrate through the stratum corneum on contact, so that we get better transmission of the energy into the dermis. We can, in principle, penetrate up to 500 microns. Most of the time, we're not using our settings to maximal. Either the coagulation or the ablation. We'll often pick somewhere in the middle, depending on what we want to achieve for the tissue. It's really a pretty quick treatment to do. The pins, the tip covers a fairly large area, and these treatments don't tend to take more than half an hour. I've discussed the fact that we have no return electrodes. It really is a very, very easy device to use. The high energy density does give us very, very good penetration. And it's also very well tolerated. We do give our patients local anaesthetic cream, but it's a really easy treatment. They sort of describe a 1 to 2 out of 10. So the smart scan technology is extremely clever, because one of the problems that can happen is if you're working at a slight angle on the skin and not all of the pins of your device are in contact or are within the dermis, if the energy were to transmit through all of them, then that's where you could get superficial energy transmission and burns, or which can lead to post-inflammatory hyperpigmentation. So this device will sense which pins are in appropriate contact with the skin and will only deliver energy through those pins. So it allows you to treat smaller areas. It allows you comfort in knowing that if you're not at the perfect angle, you're not going to cause complications for your patient. All of the settings are fully adjustable. So if we use shorter pulses, our risk of post-inflammatory hyperpigmentation is less, and we would certainly use different settings in patients who are more at risk of that. If we use longer pulses, we'll get increased coagulation effects. We can also alter the power. So when we use high power with a short pulse duration, that's when we get our deep ablation, which is going to work really nicely for scarring. And the whole time communicating with your patients means you can really tailor it to their comfort as well. So this again shows how these columns of injury are happening. This is right down to 464 microns. So this is really penetrating deep into the dermis using 280 volts and 28 milliseconds, which is the absolute most that the machine can do. And this is the difference that a slight adjustment in those settings can make. So the one on the left is with pretty much maximal energy for 30 milliseconds. And the one on the right is maximal energy, but with a short pulse duration. And if you look through the table, you can see how much less downtime and how much quicker healing happens when you have slightly lower settings. And of course, you're going to get less neocollagenesis with the weaker settings. So it's about finding that right balance for what that patient's skin condition needs, bearing in mind their comfort and their risks. And what's very, very useful is the protocols for achieving different results for different conditions and for different skin types come with the device. And with time and experience, you might start to play around with that, but you can have confidence in what you're given. And this shows the difference between low, medium, and high settings. So obviously, this is extremely zoomed in. When you see someone who's been treated with those low settings, even an hour after treatment, you'd struggle to see that anything had been done. The one in the middle from a distance would probably look a bit sunburnt. And the one on the right would look quite red, probably would develop a little bit of dermal swelling, maybe not immediately, but within the first 24 hours, and would have more significant downtime. The middle setting would almost certainly, by the time they woke up the next day, look pretty normal. And that's a beautiful thing for people these days who, usually not in lockdown, live busy lives and don't want to be taking time off work. The Venus Viva also comes with the diamond polar applicator, which is multipolar RF combined with pulsed electromagnetic fields. So this is particularly nice for, I find around the eye area, for example, where the combination with the pulsed electromagnetic fields is unique to Venus. And particularly for people struggling with dark under eye circles, it's a beautiful treatment. And we've even done combinations of using the Venus Viva to help people with fine lines and wrinkles with the diamond polar tip to stimulate better lymphatic drainage, better circulation. It's a really nice combination. The bigger version of this is also fabulous for body treatments and is our go-to for skin tightening on the body. Completely no downtime, feels a little bit like a hot stone massage, non-invasive, and so suitable for all skin types. And I'm going to just share a few more results with you here. So this is a lovely example of rosacea. And by using settings aimed at coagulation, you're really going to get better control of the microcirculation to the skin. And so aesthetically, this is after only one treatment, you can achieve some really impressive results for some of these patients. And again, the skin texture and quality improvement. And you can also see it looks in the before like there's fairly significant pigmentation above the lip, which looks markedly improved in the after picture. And I mean, this patient looks, the improvement in her skin quality in this photo is remarkable. The appearance of her jowls has significantly improved, and some of these elastotic lines in the perioral area look markedly better. And again, just to show it's not just for the ladies on, and the texture improvement in the skin here again, I think is really excellent. And these are skin types which, if I were looking at doing other techniques like chemical peels, some deeper chemical peels, I might be a bit more hesitant to treat. So this one, after 7 treatments, I mean, that's a remarkable result if you look at the improvement in the skin texture on the cheeks. And texture is something that's so hard to hide with makeup. And this isn't a neck, and necks and décolletages are another area I use this device a lot. So the skin tightness that's been achieved in that neck is impressive. So here we go. I'm happy to take any questions and answer as I can.
That was great. Thank you so much, Sophie. We do have some questions. So what I might do is just make you and I a bit bigger. There we go. Yes. Okay. Let me start just going through the questions. Okay. So someone's asking how the device is different to fractional ablative lasers such as CO2 and ER-YAG.
Yeah, so obviously it's a different technology. It's radio frequency versus laser. So laser, both treatments ultimately lead to heating in the skin, which is how they're going to achieve their results. But with this, the predominant difference is obviously the way that heat is created and delivered, and also subsequently the risk. So when compared with fractional laser, the risks of PIH with this technique are significantly lower.
Great, thank you. Okay, how long would you wait before treating post-surgery scarring with the device?
I would probably, it would depend a little bit, I guess, on the scar and on the surgery they've had and on the reasons for that. I would probably say 6 weeks. Let the scar go through the wound go through its initial healing process. And provided you've got reepithelialization, you'll be able to help the scar mature much quicker and better by using this.
Okay, great. Okay, what parameters in terms of voltage and time do you use for stretch mark treatment?
So, I actually I can't tell you those off the top of my head. So we have, the way we use the device, I can go and look because it is in the clinic, is we have our protocols attached to it. Yeah. And I always refer to the protocols first. So that's where I look, and then what we'll often do, we'll usually patch test someone, and I'll usually patch test on 3 different settings, and according to patient response to that, I'll choose my settings. Yeah. So I can't actually tell you that off the top of my head.
Well, no, that's
because
fine.
We've got so many different things we treat with it.
Yeah, well, what we can do, just the person who asked that question, we can just put you in touch with Venus Concept, and you can ask those questions directly. We'll get some contact. Yeah. Okay, cool. And then, okay, so someone else has asked how early you would treat a stretch mark or scar, but then also what kind of home care you would recommend for stretch marks on the body.
So when someone's going through the treatment, so through the treatment course, we actually give out really gentle products to use at home, because if someone's on anything too aggressive, they're going to have more downtime and more reaction from the treatment. So we give people a bundle of really gentle barrier repair focused product and SPF. On the body for stretch marks, so while they're having this treatment, we would stick to exactly the same rules. We wouldn't put anything on that's aggressive. It's very, very tricky. You're never going to get adequate results with purely topical treatment for stretch marks. I do believe the earlier you get in there, the better. So treating pink stretch marks is absolutely fine. Some people may talk about using retinol. I think there's no reason why you can't, but the results will be limited compared with actually an in-clinic treatment like this.
So it's always best in combination, like most things, really.
Yeah, they're so tricky, and something obviously that a lot of women struggle with, particularly women at some point in their life. But yeah, in-clinic treatment is the way forwards, really, with supportive home care. But for me, what I meant more by that was that actually I'd focus on barrier healing and repair while they're having the Viva.
Yeah, cool. Okay. And are there any other sorts of technologies that you would combine this, the Viva with, depending on what it was that you were treating for the patient?
I mean, I'm a big fan of combination treatments. I do think that's where best results lie. Every patient, I think, who's investing in clinic treatments should also have home care products. In terms of other treatments that we combine it with, sometimes for rosacea patients, we might combine it with other vein treatments like Thermavane to treat bigger spots or telangiectasia. We will combine often with LED light afterwards. What else have I combined it with? Obviously, as I discussed, the multipolar radio frequency, we often do that as a combination because they do different things.
Yeah.
And injectables, there's no reason for me why we have some people, for example, when I get bad acne scarring patients, one protocol I quite like to use is to do a Venus Viva, and then 2 weeks later I bring them in for a very superficial chemical peel, and it just helps. If there's any residual slight dryness, it just lifts all of that off. And I do a course where I alternate every 2 weeks with that, and that works very, very nicely. Again, depending on skin type.
Yeah, fab. All right then. That's probably all we're going to have time for. What we'll do, was there any contact details that you maybe just want to share again, Sophie, or your handles on social, perhaps, if anyone wants to check?
Yeah, absolutely. If there's a question that hasn't been answered and you want it answered, feel free to ping me a message, probably either Instagram or Facebook. On Facebook and Instagram, I'm Dr. Sophie Schotter. That's my professional pages. So yeah, feel free to ping me a message and I'll always get back to you. Might not be straight away, but I promise I will.
And yeah, if anyone has any other questions for Venus Concept, if you put back onto the event page for the AM virtual event on Facebook, we do have brands. The brands are on hand there just to answer any questions. And if not, we can make sure that those get passed on for you if you've got any specific questions about the device or anything else. But yeah, with that, I think we are done. So thank you so much, Sophie. That was great. Thank you, everyone, for tuning in and for your questions. And we will see you a little bit later on for our last session of the day, and then all day tomorrow for the last day of the AM virtual event. So thank you very much, everyone. Thanks, Sophie, again.
Bye.
Bye.